I'm Dr. Jennifer Heidman. I'm the medical director of Redwood Coast PACE. I wanted to talk to you all during this time about goals of care. Now, I've already had this discussion with many of you, but I think it's really important during this particular time to make sure we understand what kind of treatments you would want if you were to become very ill. As you know, we're in the process of a pandemic, which is the coronavirus. The disease is called COVID-19, and the virus SARS-CoV-2. And thankfully, I think we're doing a pretty good job of reducing the spread of this disease and slowing it down by staying isolated, which of course has been really hard for all of us not to be able to connect in person. We still don't know for sure if this will get worse or better in the coming months, and I think it's very important to prepare ourselves for the possibility of getting sick. And I actually think this is an important discussion for people to have with their loved ones throughout their lifetime, no matter what's going on, so that if something changes with our health, the people that care about us and our healthcare providers, like myself, can advocate for us when we're ill. So a little bit about this virus. It's a little bit unpredictable in terms of how people respond. Some people will have the virus and not even know it. In other words, little to no symptoms, in which case that's great for them, although another great reason why people need to wear masks, wash their hands, and stay distant from others, because you may not even know if you're walking around with the virus and transmitting it to others. Some people will get the virus and they sure will know it, and they'll be pretty sick for a couple of weeks, but not sick enough to end up in the hospital or into the intensive care unit. But there are a percentage of people who will become very ill if they contract this virus. What we know to date is that this tends to be older people and people with chronic medical conditions like high blood pressure, diabetes, heart disease, lung disease, cancer, and anything that can suppress your immune system. So for me, as a medical provider and as a human being, I would like to make sure that I open the discussion very honestly and sincerely around what people that I work with in my practice at PACE would want done if they were to become very sick with this virus. Now, one option for treating people who become extremely ill with this virus is intensive care in the hospital, and often going onto a life support machine called a mechanical ventilator. The reality of this, from what we've seen so far, is that many people will not recover, even with the intensive care and ventilator use. And if they do recover, it can be a very, very rough recovery time, and they may never get back to a normal baseline of their life. We also know that people can go from being a little bit sick to just about to die very quickly with this virus. And so there isn't a lot of time to have discussions about what the next step is if someone's suddenly ill, which is why, again, it's best to have these discussions when there's no crisis at hand, when we're feeling okay, and when we can think clearly about this. The other thing to think about is if your heart were to stop, would you want someone to try to bring you back to life with cardiopulmonary resuscitation or CPR? Now, on television, this is usually a pretty slick procedure and people come back and they're right back on their feet. In real life, when people are sick enough to need CPR, things aren't usually quite as smooth. Certainly, if someone is needed to be resuscitated, they will end up in the intensive care unit, likely on a mechanical ventilator for days to weeks, and may end up needing nursing home level care after the hospitalization if they are to survive. There does tend to be risk for brain damage and certainly complete physical weakness and organ damage when people undergo a cardiopulmonary resuscitation attempt. We do know with this particular virus that if you are sick enough to require the ICU, a ventilator, or CPR, the chances that you're going to survive and get back to your normal baseline are pretty slim. Now, this discussion is really targeted not to talk people into one choice or another, but rather just to get you thinking about what would be important to you. If you were facing an illness like COVID-19 and were facing the prospect of being taken into the intensive care unit where you would not be able to be visited by family or talk or interact with others other than the healthcare providers, what would you want? What would be important to you? I do want people to know that whatever choice they make regarding this care, our PACE team will support you, and that there is always a way for people to have their suffering, symptoms, fear, anxiety reduced and treated, and that this is a very important part of medical care as well. This is just to open up this discussion. I'd like people to start thinking about this and to know that people on our team may want to talk to you about this. And if and when you're ready to talk about it, you can contact us directly, or just know that it might come up in discussion when we're reaching out to you during this shelter-in-place time. Finally, I'd like to say I hope everyone is doing okay and that I very much miss seeing you in person, and look forward to the day when we can reopen our day center and get back together as a community. All right, everyone, stay healthy.